Wild Health is about optimizing you. We use genomics, blood work, biometrics, microbiome assessment, many other tests, and a conversation with you to come up with a full health optimization plan. What's the perfect diet, exercise, and supplement plan for you and only you? The Wild Health Podcast is about optimizing all of us. Here we cover the cutting-edge science that gives you the base to be able to apply the personalized plan we give you as a patient. To sign up as a patient, go to wildhealth.com. Or if you're a physician or health coach and you want to learn how to do this for your patients, we're happy to help as well. wildhealth.com for all the information on becoming a patient or working with us.
Hey everybody, welcome back to the Wild Health Podcast. Mike Mallon here. We got 6 jillion emails and requests to bring Dr. Matthew Slater back on the podcast to talk a little bit more about athletic performance and just see what we could extract from the dense knowledge that is his brain. So here to help me do that, again, is Dr. Mark Goodman, and then as mentioned, Dr. Matthew Slater. Mark, what are we going to talk about today?
So we were going to try and focus in a little bit on the master's level athlete and what that means as far as adaptation and how you would change training plans, recovery, and as you age, how you can train maybe more effectively. So Matt is an expert in this area, not only being a cycling coach, but a high-level master's level athlete himself. And then on the side, he dabbles in cardiac surgery. So I think he's the perfect guy to talk about stuff like this. So Matt, welcome. Thanks for coming back on. I guess just to kind of get us started, we dove in a little bit on this last time, but as you age, we know there's some physiologic changes that go along with that has to change how we approach exercise and recovery. Can you maybe talk a little bit about, I guess, first, what is a master's level athlete? Like, is Mallon a master's level athlete now?
Hold on now.
Well, how do we define that, and what does that mean? And then, in the context of coming up with a training plan, how are you considering that, and what kind of changes are you making?
Well, thanks, first of all, for having me back. I really appreciate it. Yeah, I think that the boundaries of what is athletic performance as we age are changing. I mean, Alejandro Valverde is racing the Tour de France, and he's 40 years old, I think, this year. So he's competing at the highest level in the world at that age. So our definitions of what is a master's level athlete definitely are changing. We used to just say, over 35, that was masters, at least for the cycling world. But I think those definitions are a little bit arbitrary. What I do think is pretty well known is that as we age, we have multiple physiological changes that affect our athletic performance. And I'd kind of break those down into 3 main points. The first is we know we have decreased aerobic capacity. That is the ability to have a high workload for a long period of time. And that's driven mostly by reduction in max heart rate as we age. There's this formula where you take 220 minus age, and theoretically that's your max heart rate. That's been pretty much shown to be inaccurate, but the general concept that as we age, our max heart rate goes down, and that then decreases our aerobic capacity, that's pretty well established. Number 2, as we age, we lose muscular body mass, our total muscle mass decreases, and that can be mitigated. And we can talk about this later with, weight training incorporated or on bike strength or anything like that. And then finally, as we age, our sort of proportion of body mass changes to being more fat if we're not really careful with our diet and such. So those 3 things, decreased aerobic capacity, decreased muscle mass, and increasing body fat, are sort of what you're trying to address when you talk about training older athletes. Saying exactly who's a master's athlete or not, I don't think there's like a hard stop to where that is, or where people fall off the edge and they're suddenly a master's athlete.
Great. Well, I think looking at that kind of decline in VO2 max over time and how that affects training. So it sounds like that's primarily then based on a decreased maximal heart rate. So are you noticing then also decreased stroke volume, decreased cardiac output? And is that the primary driver then of decreased performance over time? And if so, is that something you can mitigate by certain training strategies?
Yeah, so I think that's a really good question. The The majority of the decrease in aerobic capacity is just in terms of max heart rate. So your cardiac output is determined by how many beats, per minute, and then what the size of those beats are. And sort of each heartbeat is you sort of fill up the heart with diastole, the heart contracts, and you eject some blood. And the difference between the heart when it's fully relaxed and when it's fully contracted, that's how much blood you eject with each heartbeat. Your ability to relax the heart. We talked a little bit about this a couple of weeks ago when we were talking about cardiac fibrosis. Your heart gets stiffer as you age, and therefore it doesn't relax as much. Therefore, it doesn't fill as well. Therefore, the stroke volume goes down. But that difference is smaller than the change in max heart rate for the majority of athletes. But they both contribute. And for that reason, you have less cardiac output, and therefore VO2 max drops off. In terms of what you can do to mitigate it, there's pretty good data that people who remain active through their 40s, 50s, and 60s, and there's been long-term longitudinal studies on large numbers of athletes, that can be mitigated to a large degree. It can't be completely paused, but it can be stopped. And it can be stopped by doing various types of exercise. It does look like as we age, intensity becomes pretty important as opposed to just pure volume, so that maintaining some degree of high intensity exercise, above lactate threshold, maybe above FTP, hard intervals at some duration is important to preserving your VO2 max and stuff. That then I think gets complicated in masters athletes because most masters athletes need more recovery. Whereas maybe at 20, you could do 2, 3, 4 really hard interval sets in a week. As a masters athlete, as we age, our ability to recover is not as good. And you have to be careful with the dose of that intense exercise, even though it's important to mitigate decline in VO2 max. You can't overload your masters athletes. You have to be careful with that.
So kind of getting back to what we talked about in the last podcast too, with using exercise as a drug or an intervention, and like any other drug, dosing it appropriately, and then having periods of structured rest built into the program. Some of the background reading I did on this, the general decline in VO2 max, they say, is about 10% per decade for sedentary people over the age of 30, which is pretty, kind of frightening when you look at it. But I also found a few things showing that you can really kind of head off that decline if you stay active through those years. I mean, you're going to have a gradual decline in VO2 max with time, but it doesn't have to be this steep decline with aging. And there's also some thought that maybe this VO2 max decline is a centrally mediated process too. Like you don't have the time, or you lose the training volume or the motivation to have the intensity of training that you did when you're in your 20s and 30s, and maybe that's playing a role. Is that something you've experienced kind of in your coaching side of your career?
Yeah, I think that's a really interesting topic, and Noakes and others have talked about this concept of central governor, where what is it that really makes you sort of back off the throttle, or certainly there's a recent book called Endure, and I'm forgetting the author, but talking about what is it that makes people stop running after 6 or 12 hours or whatever at the end of marathons, and this idea of central governor where you back off. I have actually not experienced that with most of my masters athletes. Like, it may be that the people who don't like to train sort of stop training as they get older. They just leave sport. But most of my athletes, I have a bigger problem with them overtraining and not taking enough recovery. And they just like to ride their bikes and they like to go out and go hard. And training is sort of stimulus plus recovery. Like, if it's all stimulus and it's all just loading up, and trying to get training effect, and like you said, it's a dose, they just kind of overdose on the stimulus part and they underdose on the recovery part. And I think finding the right balance for athletes, regardless of age, is super important. But I think you have less margin for error with the masters athletes.
That's interesting. So coming back to that training and recovery and dosing appropriately, do you find that you're using certain tools like a TSS score, a training stress score? Is there anything that you're kind of using as a metric to track your own training or your clients' training over time? Is FTP kind of the gold standard, or is there something that you're using as far as how they feel, and maybe more perceived rates of recovery and soreness, and just subjective measures as opposed to objective markers?
Yeah, I think they're both really important. I mean, bicycles are nice because you have power meters on them, so you can get a pretty objective measure of how much work you're doing. And I do like both CTL, sort of looking at the training stress score over time, and then acute training load. Training peaks is kind of the gold standard for how to do that. They have a formula for doing that, but you do get a number that does correlate with how much work the athlete has done over the last 10, 20, 30 days. And then you can even look farther back and build a season. So I do like using training stress score and then the sort of aggregate markers of a training stress score, the acute training load and the chronic training load, to see where people are going. And I like that for two reasons. One is that for most of my super competitive athletes, you really don't get them maxed out until they have like 80, 90, or 100 CTL, if they can tolerate that load, so that that when you're trying to peak them for a big, A race of the year or best race, you should do that. But I do think, and then the other thing is you don't want to ramp people too quickly. So by looking at their training over time, you don't want to take someone who's doing, some degree of either volume or intensity, and bring them up too quickly, because people tend to implode. And I think this is the benefit of base training to some degree, and sort of zone 2 training, is that you can kind of slowly build up that training stress, and then start doing more specific, more polarized work. Getting back to your question about sort of are these subjective measures better than more objective measures? And I think the key is to sort of incorporate both of them. And so I would call the sort of super objective measures things like training stress, heart rate variability, resting heart rate, things like that. And then the more subjective things would be, how does the athlete feel? Like, I know that like when athletes start getting really grumpy, or like they're having, they try and go on the bike and like they just don't want to do it, and they're losing motivation, and like they're fighting with their significant other. Those are also good markers for things.
I was about to say, you should just ask the spouse. It's like there should be a spouse score or something.
Yeah. If you want to know if an athlete's overtrained, don't ask the athlete, ask their wife.
Yeah, right.
Like, this is like a fundamental tool for coaching people, because like they're basically, what they're usually doing is like, I'm going slower, I feel badly, so clearly the answer for this is to go out and do more hard intervals. So once you get into that like sort of mentality, things do not go well.
Yeah, I'm so glad you brought that up, Matt, because I think, we'll probably talk about some of these like fancy recovery metrics here in a little while, like HRV and resting heart rate, and looking at all the data on training peaks. Like, it's so cool to see graphs and ramp rates and TSS. But if your numbers look great and you subjectively feel lousy, and you're not sleeping well, and you feel like you're not recovering, in my mind, that kind of trumps some of these more kind of fancy metrics that we have to follow. So putting all of this in the context of the overall athlete and the picture of what you're seeing, I think, is really important.
Yeah, and I would also say, just backing up a little bit, although as we age, we have, reduced aerobic capacity and our muscle mass goes down and those kind of physiological parameters. As we age, we sort of collect some other things, which I would say would be like, we tend to collect a family, a job, and injuries. So that's sort of extra baggage on the back of a lot of masters athletes. And, not that those are, bad things or whatever, they just need to be acknowledged. And so if you're injured, if you have a time in your life where, you're working really hard to move forward in the workplace, or there's family commitments that are big, you have to sort of factor that into the training mix too, because those take a toll too. They don't show up on training peaks as training stress score. They probably do show up in heart rate variability and other things.
I've noticed that just on my tracking my athletes and some of my own recovery metrics, that HRV number is definitely, and resting heart rate, some of these numbers can be influenced a lot by stress outside of training stress, whether it's work or sleep or other things, that it is kind of a nice another number to have that gives you some indicators of stress that maybe isn't just stress on the bike or stress running or in the gym.
You know what was really interesting for me is I did a training program probably 3 or 4 years ago now, that with the intention of overtraining. Like the whole idea of the training program was that basically you overtrained for 3 weeks to the point that you felt terrible. And then you took 2 weeks off and then you repeated the process. This was like some concept that somebody came up with. And I was like, I'll give this a shot. And what I will say is that while it's a ridiculous way to train, it was really helpful to understand what it feels like. Because without a doubt, you know that you're overtraining. I mean, you're doing like 2 or 3 a days for, like several weeks straight. This is what overtraining feels like. And I feel like while obviously if you look at the American population, the major problem with our health of our population is not overtraining. If you take our group of patients, people listening to this podcast, that is probably the predominance of the problem. And it's really helpful when people actually understand what that feels like, because subjectively, it's not hard to realize when you're overtraining if you've been there before and you can say, this is what overtraining feels like.
And some of these devices like a Whoop or Oura Ring can give some clues as well. But yeah, I totally agree with you, Mike. Until you're there, and the temptation a lot of times, like Matt was saying, is to just kind of double down. Like, oh, I'm not performing, I don't feel well, that means I need to go harder, which is kind of the exact opposite of what your body really needs.
Yeah, and you need to take note of like what that HRV looks like and what that resting heart rate looks like during overtraining, or at least if you do find yourself in a point of overtraining. So that way, when it actually happens next time, you can recognize it and do something about it beforehand. If you're not working with a coach whose goal is to prevent you from getting there in the first place.
Yeah, and I think one of the issues that also happen is when people start getting really overtrained, their nutrition isn't as good because their appetite's not good, and they're starting to have GI issues, and their sleep is disturbed, and you just can end up in a really bad cycle. And I think that's overtraining, and you have to distinguish that from burnout, because you brought up the sort of mental issues, do people just not want to train? And sometimes it's hard to tell the difference between the two, at least for me. And I think some of those more objective measures can be useful, whether it's heart rate variability or sort of what the power people are making at a given heart rate. When I start seeing, as long as the temperature is constant, it's not 100 degrees out and the air quality index isn't 500 or whatever, when the, people are unable to make power and their heart rate is either they cannot get their heart rate up at sort of like endurance pace, like they're just having reduced heart rate response, not heart rate variability, but just heart rate response to exercise load. Or if they like start doing that and their heart rate's 10 or 15 beats higher, like those are signs that like there's some kind of problem with either the training load or someone's getting sick or there's an issue. And I think, as athletes get more experience working with power meters and heart rate and and the heart rate variability stuff, I think these all become like synergistic ways of figuring out what's going on with somebody. Are you burned out? Are you overtrained? Are you sick? It's a warning flag, and then you go figure that kind of stuff out. I do think it's a good idea for people to try and overtrain. And, if you look at training logs for athletes as they mature, from sort of juniors to seniors to Olympic level athletes, what you do see is they sort of go more and more polarized. That is, they start doing a lot of zone 2 or easier training interspersed with really, really hard intervals, as opposed to sort of sitting in the middle. And I think that's because they can kind of understand where they need to be on that spectrum and have a better idea of where they need to train and sort of how easy they have to go so that they can do the really high end work. And that takes some time to figure out. And all these tools, these sort of objective tools can help guide athletes to that. And then obviously working with a coach or.
And so, Matt, I think what we're talking about is maybe not overtraining, but this idea of overreaching versus and functional versus non-functional overreaching, because I think that's what you're referring to, because I think that idea of functional overreach is certainly important for adaptation, where you're stressing your body to have an appropriate response. It's when you get into that non-functional overreaching that then is kind of a spectrum towards overtraining and then towards burnout, is when we start getting worried. And that's a difficult kind of line to determine sometimes. I would agree with you, though, when I start seeing in athletes or in myself, when you're out and your RPE or your perceived exertion is high, but you're not able to elevate your heart rate, that's a big red flag. That means there's something centrally going on, I think. And that's probably a step even past the point where you're having an increased heart rate response with a decreased power output. So just a good plan and a cycle where you're having those periods of this functional overreach, then followed by appropriate rest afterwards. And when you're dealing with that in the master's level athlete, you mentioned that how much more important rest and recovery are after those big training blocks. Are there any specific modalities or kind of methods you're using in that population that you found to be effective, or what are your general recommendations?
Yeah, so we talked about this. I'm a simple guy. I try and make sure people are taking care of the low-hanging fruit ahead of time, and those are things like making sure people are getting a reasonable amount of sleep. Naps are like the cheapest energy hack or recovery hack out there. You get growth hormone production with naps. I mean, they used to, when I was, a guest at the Olympic Training Center when I was a young guy, they would force us to take a nap. You had to go to your room. These were 23-year-olds, go to your room. You have to take a 20-minute nap because the data was good even then that it makes a difference. So yeah, it's not as sexy as a whoop strap, it doesn't require special equipment. Most people have some place to lie down on, but I think taking a nap and then good sleep hygiene is super key. I think, fueling appropriately, both pre-ride or pre-workout, during the workout, and after the workout, and just sort of general nutrition is super important for masters athletes. Greg LeMond said, I think he said this, you could do the Tour de France eating Twinkies. I mean, I think maybe if you're at a younger age, there's a little bit more margin, but I think as we get older, making sure that sort of our macronutrients and stuff are lined up and we're eating good quality food, that does make a difference. In terms of more complicated stuff, you start talking about when you should drink recovery drinks, things like protein, either on the bike or after the bike. I do think that, not everybody can tolerate this from a GI standpoint, but you can start the recovery process when you're on the bike. And so a couple of companies make on bike products that have some degree of protein in it, whether it's Heat or Spring Energy or whatever, that have fat or protein in it. And I think getting some protein on the bike is reasonable. And certainly there's some data for moderate amounts of protein right after exercise. If people can't tolerate protein right after exercise, it doesn't make them feel good. Even just getting a good, low glycemic carbohydrate drink in with electrolytes and fluid, that's when you start your recovery. So I think that's useful.
Are you changing those recommendations based on the workout that you're doing that day? So would that be different for a 45-minute high intensity interval session than it would for the 6-hour zone 2 session as far as fueling? And then kind of tying into that, any experience or role of fasted training, and is that something that you're using for either training stress or recovery at all?
Yeah, so I think really good question. So I do think you should modify your amount of, the companies would like you to take a gel every 7 minutes or something. And, I think what I advocate is that people eat a appropriate breakfast or lunch or whatever before their training, and then give that an hour or two to sit, and then do the training. And if it's under 2 hours, I don't think you need, unless you're doing some very high intensity stuff, I don't think, assuming you're glycogen replete, you haven't been doing 6-hour days end on end. I think most people don't really need that much stuff. If someone wants to take a carbohydrate drink on the ride, and certainly if it's hot out, something with electrolytes in it, I think that's great. But I don't think you need to subject your body to a lot of super high glycemic loaded gels to make it through a sub 2 hour workout. If you're going out and doing 6 hours, zone 2 and stuff, I think it's important to eat. And I try and get my athletes to eat real food, to make a sandwich with, meat and avocado and cheese. And if you can tolerate that at zone 2, I personally, if I try and do that and I'm doing intervals, I end up with food coming out my nose and frightening everybody around me. So, That's
Eating an
obviously not going
avocado
to work.
sandwich while doing intervals seems like that's a challenging workout right there.
Yeah, yeah.
Matt,
Plus,
at
you're
what
like
point do you
aspirating bread pieces and stuff.
at what point do you recommend that I drink the Red Bull or the Monster Energy drink? Is that before or after, or just at when I'm getting the trophy?
So both the taurine and the caffeine and Red Bull, like those are both ergogenic aids. I think those are really good pre exercise, like caffeine or taurine or some of those things. I think pre is really good. I think huge amounts of caffeine on the bike you have to be careful with for GI reasons, but I'm a big believer in caffeine. Like it definitely works for me. I think pretty much every bike rider I know will drink coffee and take some kind of caffeine. So in a race, I will definitely start with some caffeine and then have more caffeine to finish the race. I don't take any caffeine tablets. I just think that's a little overkill, but caffeine in the gels or stuff. The Red Bull in the race might be a bit much for me to recommend, but you can
So it sounds
celebrate
like
afterwards.
kind of adjusting that fueling strategy depending on the work required and not really sticking with a strict every time I ride, I eat 3 gels kind of mentality, but more dialing it into what you're hoping to accomplish that day, potentially, and the work required on the bike, and then playing that into off the bike or kind of post workout nutrition. Are you titrating that, or do you have kind of a general recommendation or formula that you're using kind of after a workout? It sounds like some protein and some complex carbohydrates as well.
Yeah, and hydration too. I think that, athletes, when they're doing longer rides, especially in the summer, it's worthwhile for them to weigh themselves to kind of better figure out what their total fluid loss is. It's pretty surprising, even, lean 150-pound cyclists will lose 5 pounds going out and doing a long 3 or 4 hour ride. So I think replacing that as quickly as possible is good. I think if people like to make a protein shake, with, 20 grams of protein or 30 grams of protein powder or something like that mixed in with a lot of volume and stuff, I think that's great. If people can just eat a regular meal and fluid, I think that's good too. Again, I think trying to stay away from really high glycemic loading, super simple sugars, not as great, although probably in the first half hour it doesn't matter what you eat as long as you get something in if you're in a glycogen depleted state. And then if you're doing big training volume, I think paying attention to make sure you eat more. If you're trying to do, a conversion, where this is probably an entire podcast to convert over to more fat burning ketotic athlete, which I think can be effective for super long distance athletes, then you have to be careful about that. I can't do super high end training without carbohydrate. Like that's just something I've come to figure out. Like I can do low end training and go out and ride 4 hours without eating any food if I'm eating a lot of fat and protein, but I can't do work above FTP. I just implode. So I think, if you're going to try and do either sort of paleo or ketotic even diet, you have to do that in a really careful way and make sure you're converted and be really careful with the high end work, or otherwise you can end up in sort of a bonked situation, because you will improve your insulin sensitivity and other things, but you will also end up in sort of some low blood sugar states if you're not careful. I don't know what your experiences have been with trying to convert athletes over to more ketotic or paleo kind of diets.
I found it to be pretty individualized depending on the person, and then also just really trying to dial in when you're using that kind of glycogen depleted training and being sure that you're using that appropriately, and kind of ramping that up and treating it just like another training stress. Those days where you're glycogen depleted are going to have more stress than the days where you're running on a full glycogen load. So using it sparingly but appropriately has been my experience. But I think there is a role there, certainly. And I think a lot of these big tour riders, because the tour's going on right now as we're recording this, there's been some lots of training in different carbohydrate states and glycogen depleted states to increase mitochondrial biogenesis and increase that fat burning response. I think we're learning more and more that you're never going to, or you're not going to get to a point where you're burning purely fat for fuel. But if you can change that ratio a little bit and not be so glycogen dependent, especially in these longer events where you can more efficiently utilize fat as an energy, that can really have some benefits. So I think it's a really interesting training strategy, and probably something to layer in once you've really optimized the basic stuff. You've got a good training plan, you've got good recovery. This is a next level kind of intervention to add on top of that, in my mind. So circling back, Matt, to something you said just on, how we age and what that does to our kind of overall endurance performance. You mentioned the cardiac factors, which kind of talked about with decreased cardiac output, but then also these more peripheral factors. So decreased exercise economy when we're talking about things like decreased muscle mass and changes in body composition. And so how is that playing into your coaching strategy in the master's athlete?
Yeah, so I think for my master's athletes, there has to be some real biomechanical problem that they come to me with that says I can't lift weights for some reason or another, or they have a strong preference. Otherwise, everyone is on a weight program. And, the typical standard teaching was, okay, you'll do like 6 weeks of adaptation, and then you'll do like 6 weeks of whatever, and then you'll do like 6 weeks of power, and then something else. And then when you start the cycling season, you're done with weights. Like that was sort of like old school, like how do we incorporate weights into endurance sports, which is like it was something separate or whatever. My thinking has changed over the last several years, and I think there's pretty good data for this, is that not only should you lift more, and that should be a portion of everybody's program, but you can probably lift to some degree through the cycling season. Now, I don't think you can do 3 days a week of legs super hard and have snap and be able to go fast and feel great. But I'm advocating once a week of weights, even during the cycling racing season, and a year-round strength program. And I also feel pretty strongly that, most people who have niggling discomfort on the bike at long distances or with high training loads, a lot of that is just due to core stabilization and small muscle stuff. Cycling is like the most fantastic exercise for developing like one biomechanical motion pretty much. Cycling, cyclists do one thing pretty well, and like anything that disturbs that, they get out of whack and they get injured. And you can mitigate that to some degree with doing more core work and more functional strength. So I don't think everybody needs to be doing max 3 rep squats, but I do think everybody needs to be doing a functional strength program that moves people both for the standard muscles for cycling, quadricep engagement, hip flexors, all this kind of stuff. But I also think that some lateral motion and a lot of core and functional strength is important. I'm a little mixed on sort of plyo, jumping up and down on things, and more dynamic stuff, because I think you have to be careful with master's level athletes. Their tendons and ligaments are not as pliable as like 20-year-olds. And so I'm a little cautious with that work. That stuff is clearly effective, but having someone have an injury is not very effective training strategy. So I tend to not use dynamic stuff, but a lot of lateral stuff, a lot of bands, a lot of body weight exercises, a lot of plank kind of stuff, and then a lot of one-legged exercising, to isolate stuff and to help with stability and balance. One-legged squats, split squats, stuff like that.
I'm glad you brought that up. And in my practice, I see a lot of cyclists who tend to be really tight through their hips and very quad dominant and have weak posterior chain and weak core, because as you mentioned, I think cyclists are good at pedaling a bike, but they're pretty lousy at many other things. So having an appropriate off-season strength program where you're doing those lateral movements, especially, which is something that's lacking on a typical on a mountain bike or on a road bike, where you're just really working kind of in line, I think is key for injury prevention and just for overall longevity as well. So I'm glad you're working your athletes in that direction as well. When you are programming for your master's athletes, do you have any certain supplements or any other cheats or hacks that you're recommending? I mean, if I just don't want to do the work and I want to get really fast and ripped, what can I do? I guess is what I'm asking.
I don't think there's like a magic tablet that I'm distributing to my athletes
I'm
or anything like that.
juice right now. That doesn't no beetroot juice with a
Nope. So
BCA
that's what I was going to say, actually. So
repository.
yeah. So, sorry, your audio broke up a little bit. So I don't think there's like any magic. Like I do think being properly fueled before exercise and then being able to recover effectively, those are like keys from the nutritional supplement standpoint. I think people have to be careful with supplements because, like, if you take a lot of super high dose supplements, some vitamins will interfere with absorption of other vitamins. And so if you're taking, 4,000% of the RDA of some vitamins, it will impair the ability for your body to uptake other stuff. So the more nutritional stuff you can get through normal food, the better. The beet juice, like I've worked with like both creatine and other supplements like that, and have not found that makes a difference for my athletes or myself. But you had brought up the beet juice, and I have been using the Beet Elite stuff before doing super high end or really hard interval sets and before competition, and I think it works. There's some data for it, but I will tell you subjectively, that is the one thing I have found to be two things, that and caffeine. So the Beet Elite, which is, beet juice powdered extract that you mix up and take, and then caffeine have been the two things that I think can get people through harder workouts and therefore get more training stimulus. So I think that's effective.
The mechanism there, Matt, correct me on this if I'm messing it up, but the beetroot juice is a nitric oxide donor, so it's a vasodilator, which helps you then get more oxygen and to the muscles during exercise. Is that the thought behind that?
Correct.
Okay.
Yeah.
Okay.
And nitric oxide is, has a really short half-life, and it's a super potent vasodilator. So the idea is that you can get, just like we try and grow capillaries through, training, this sort of opens them up maximally in the muscle beds, and therefore you can exercise at a higher load, and you can move more blood through the muscle.
That's interesting.
I was racing cyclocross last year and showed up to this race in Portland. This is such a Portland thing. This guy is actually juicing his own beets on the back of his car, preparing for his race, warming up on the turbo trainer. I just thought that was like such an awesome encapsulation of not only Portland, but cyclocross in general. So I think there's a lot of people using that and have had some success. And so kind of tying all this stuff together, I think we've been talking mostly about the kind of elite level masters athlete. How would you take the things we've talked about here and then apply it to the aging athlete who's maybe not really as interested in high performance and winning races, but just, continuing to perform well and feel good and train, but with a focus towards longevity? What are some points that you can apply from this kind of high level population that would fit with kind of anyone as they age, and how to adjust training over time?
Yeah, I think, the keys are that I think you have less margin for error, whether you're a high, and masters athlete, or you're just a person getting older but wants to stay fit and healthy. And so because of that, you have to listen to your body more carefully as you get older and take the recovery and take care of yourself. And I think that you have to devote some time to doing things like, we didn't talk about this, but foam rollering or resting. I think those things have broad applicability, not just for the elite athlete. I think they have the same, applicability to the general population. Strength training, core stability, balance stuff. I mean, there's pretty good data that maintaining upper body mass in certainly males, a little less clear data for females, but maintaining upper body mass as we age makes people live longer and have higher quality of life. So, some kind of formal or weight or functional strength training, good recovery, good nutrition. I think those are just as important for the person trying to be fit rather than just competitive. I think the lessons are true for both populations.
Great. Well, thanks, Matt. Anything we didn't touch on as far as hacks? I guess I'm I'm mostly just waiting for your secret of how you're staying so fast on the bike as you get older, because I feel like you're one of those athletes who've probably gotten faster with time, which you do see. I think there's some people out there that, they really hit their stride in their 30s, 40s, 50s, whether it's just dialing in their training or recovery or nutrition or a combination of all those things. And so I'm hoping I can kind of follow your footsteps as I enter that master's category. Well, I guess I already had to check the 35 plus box in the cycling form, which was a little bit of a rough day, but at the same time, I think it is something that, is really enviable how you've been able to navigate that and then apply it to your, not only your patients, but your coaching clients as well.
Yeah, I think one of the things, one big lesson I would learn is, as I've gotten older, when I ride slow, I ride a lot slower. And when I ride hard, I ride a lot harder. And I'm much more polarized in terms of my training. And to do that, you need to pay more attention to your recovery and your nutrition and your sleep. So you have to be, I think, a little more thoughtful to make gains as you get older. There's less. You don't no free ride as you get older. I have bad news for you. It's going to get worse. You're going to have to be paying even more attention. But yeah, I think Ned Overend, sort of this amazing physiological specimen, he's talked about, as he's aged and he's, won nationals and worlds, for mountain biking. He's just an amazing athlete. But he's talked about, he does a lot of the same training. His interval sets are the same hard interval sets. He goes out and does the, Tuesday night ride, but he doesn't do as much of that. So the intensity is still there. The volume of intensity is not, and the total volume is not as great. So I think you trade off some volume just because I don't think you can take quite as much physiological load, especially at the high end. And, the trade-off is that you do a lot of recovery and you do a lot of lower, sort of lower intensity work. That being said, there's a lot of really good long distance cyclists who are older. So clearly you can turn yourself into a diesel as you get older, but you have to be careful with the balance.
Great. Well, thanks. And Mike, any kind of closing thoughts on how to put this together and apply it, not only to masters athletes, I guess, but across the board to people just looking to get fitter as they age?
I mean, I've been thinking about it. Like, it seems like there's a lot of corollaries between cycling and really any other sport. Obviously, there's going to be some differences, but the thing that I keep hearing is recover better. And whether that's a focus on transitioning, sort of like you were mentioning, Matt, to polarizing your efforts so that there's greater high intensity, less higher intensity, but then in conjunction with that, more zone 2 or lower intensity work, you can really cross apply that to just about any other sport. I think focusing more on recovery, whether that's active recovery, such as, zone 2 work, or active recovery on a foam roller, doing that more often seems to be the most pertinent thing. And, as I've mentioned before, that seems to be the biggest problem in most of my patients, is a lack of focus towards recovery. And we were talking even before I hit record on the podcast about this concept of people who have more time to train actually not doing as well because they end up spending so much time in zone 3 or maybe even in zone 4. They're not getting as much bang for their buck from their activity, and that seems to be just a really common theme throughout every masters athlete sport, from what I can tell.
Yeah, I'd agree with you. I think the thing that I'm kind of taking away from this conversation, well, one of the main things is that the aging athlete, just the margins for error and training is so much smaller. So, whether that's volume, intensity, recovery, but balancing those things, and the role of having a coach or someone to kind of guide you through this to help with that process, just I think becomes that much more important. So you don't slip into that realm of non-functional overreaching and overtraining and burnout, but you're also sure that you're getting enough high quality work, whether it's high intensity, strength, balance, core mobility, that you're getting the benefit from all those pieces. And I think having a guide through that can be really important.
Yeah, I would agree with all those points.
Awesome. Well, I think this is probably a great point to stop, unless you have anything else to say, Matt. This has been great.
No, I appreciate the opportunity to be on with you guys, and look forward to talking to you again in the future sometime.
Nice talking with you, Matt. Thanks again. We'll talk to you soon.
Okay.
I'm gonna go take a
care.
nap.
I think you should get rested
All right.
up. Okay. Get your eyeballs straight.
Will do.
Yeah. The best cyclists are the best sleepers.
Thanks for listening to the Wild Health Podcast. If you found it helpful, give us a 5-star rating and write a review on iTunes. It really helps the podcast, and we greatly appreciate it. If you want to be a client or you want to work with us, go to wildhealth.com. Thanks again.